This is particularly a difficult plane to inject in patients post-surgically. One cc of voluma was used in this region. And quite strong massage is used in order to prevent irregularity. Anteriorly, again, we're in a deep subcutaneous plane, and this is Volift or Velour in the United States that we're using for volume augmentation. We've treated the upper face by treating the forehead and temporal regions bilaterally. Along the mid-face region, it's been treated on the right side by addressing the zygoma, medial maxillary region, and infraorbital hollow, as well as the region of the submalar cheek. We can see improvement not only of the areas of hollowness and concavity that we can see on the other side, but we can see already in the lower face increased support and a smoother jawline, despite us not even having addressed this region yet. All right, our treatment of the lower face will consist of volume augmentation of the nasolabial fold, of the labiomental sulcus, and the chin itself. We're using a 2-inch cannula, 25 gauge, to be able to access all these points from the same insertion site. Our injection of the nasolabial fold is done with a cannula in order to try and minimize the chance of injury to the angular artery. The angular artery, in about 95% of cases, sits within 5 millimeters of the nasolabial fold. About a half of the time, it's just medial within 5 millimeters of the fold. The other 25% of the time, it crosses the fold from lateral to medial, and the other portion from medial to lateral. Thus, we know that injection in this area, particularly at around the base of the nose where I'm injecting now, is prone to vascular injury. Approximately 0.3 cc's were used in the nasolabial fold on the right side. The remainder of this will be used in the chin and labiomental sulcus regions. This patient already has a well-defined chin, thus we do not want to add any width to it. We are just adding some soft tissue support to the chin itself in order to improve our jawline. This is quite uncomfortable treatment for patients in this region due to the attachments of the mentalis muscle and the dense fibrous adhesions. Thus it feels quite swollen and tense as injection is performed in this deep subcutaneous plane. Next, direct injection of the labiomandibular fold will be performed with about 0.1 cc's of voluma in this case. Treatment of the lower face was accomplished through an insertion point just lateral to the lateral commissure, putting voluma into the chin and labiomental groove, as well as direct injection through the same point into the labiomandibular sulcus. A total volume of 1.5 cc's was used on each side. Next, we're going to try and give some volume to the lip and enhance the shape of the lips in a natural manner. A cannula technique is chosen for this in order to try and evert the lip. The cannula is advanced from the lateral commissure into the body of the lip itself. Can you slightly open your mouth for me? That's great. We are injecting more on the inferior aspect of the lip here in order to try and deposit hyaluronic acid deep to roll the lip forward. It is important here to inject in small quantities in even distributions to prevent palpable or visible lumps. We are using Juvederm Volift, or Velour as it is known in the United States, to accomplish this volume augmentation to the lip. 0.15 cc's have been used thus far on this side. The lip is analyzed. And further augmentation performed. We have thus far used 0.3 cc's. The lower lip will be augmented in a similar fashion. We have now used exactly 0.5 cc's on this side. In similar fashion, the contralateral lip is injected. Further lip definition is done more accurately by transferring the Volift off-label onto a small insulin syringe with a 31 gauge needle. This is used to define the border of the lip along the vermilion cutaneous junction, to define the Cupid's bow, This is following completion of the full face treatment involving restoration and volumization of the forehead, temple, zygomatic, medial maxillary, periorbital, submalar, labiomandibular, chin region, nasolabial restoration, and lip augmentation. Our next portion of the treatment will consist of neuromodulator. We'll be using Botox to help with the dynamic lines in the glabella, to try and help with dynamic rhytids around the eye, and to raise the tail of the brow with Botox in the orbicularis region. A very small amount of Botox in the frontal region. You can see that very little Botox is necessary now after volume augmentation, as well as some Botox to the chin and the depressor anguli oris. The glabella is injected by injecting Botox into the corrugator muscle, more superficially laterally and deeper medially where the head attaches closer and deeper down to the periosteum. Approximately 25 units are used in this region. Small amount of Botox are placed laterally in order to reduce the appearance of bunny lines. The periorbital region is treated with Botox into the axial orbicularis muscle. The initial injection point is high in the temporal brow in order to try and obtain elevation by softening orbicularis contraction in that region. The needle is just inserted very superficially in order to treat the orbicularis muscle without extending deep, especially to the zygomaticus region. In this patient, it's important not to overcorrect or overtreat the frontalis muscle, as we are trying to improve opening of the eyes and not create a further descent of the brow. Thus, only 6 units will be used in the forehead region. Can you lift your eyebrows up for me like that and relax? Treatment is performed high in the brow in order to allow for a continued elevation of the brow with the frontalis muscle. Next, I'll have you, can you do this to me? Show me your lower teeth. Good, and relax. And can you purse your nose? Good, and relax. The depressor anguli oris muscle is injected lateral to the labiomandibular fold, right at the area of maximal contraction of the depressor anguli oris. It can either be injected at the midpoint of the muscle or a centimeter above the margin of the mandible. Staying laterally is important to try and avoid treatment of the depressor labii inferioris. The chin is then treated with 5 units of Botox off-label in order to reduce contraction of the mentalis muscle. The trend with injectable fillers is certainly to see patients coming to see us at younger ages. Whereas previously we were used to using injectable fillers for treating signs of aging, such as volume loss and correction of deep folds, today we're using injectables much more in a fashion to reshape the face. When patients present for facial reshaping, our first step is to identify the positive features of the face and the anatomy that should be accentuated or highlighted during our treatment. We also conversely want to look at the features which are detracting from these features and causing either imbalance or a more aged appearance. For this young patient, clearly we want to accentuate her eyes and frame the eyes. The ways that we can improve this balance is really by treating the cheek and infraorbital regions. The cheek treatment is basically a mid-face treatment that is the most popular cornerstone of any treatment we are doing for the face, whether it is reshaping or as an anti-aging treatment. In this scenario, we would like to take some of the nice volume that we see in the lower portion of the lateral cheek and accentuate it further by feminizing the cheek, creating a higher arch. If we can create more definition along the zygomatic region, we can create more height to the face and more length to this rounder face shape. When we look at the eyes, we would like to see a little bit more volume support of the infraorbital region. There is elongation of the lid-cheek junction as well as some hollowing along the infraorbital hollow. The tear trough is slightly prominent, and there is some deficiency along the lateral portion of the palpebromalar groove and lateral canthus. When we look at the lower face, we would like to try and improve support of the chin. We can see that the lips are full and beautiful and do not need further augmentation. Their shape and proportion are an ideal balance. The chin, however, we can see is slightly retruded but also rotated upwards. This is the mentalis muscle trying to compensate for a weak chin. If we can augment at a deep layer and elongate the chin, it will improve her overall profile. I will show you this on more a side view, where we have good proportion of the forehead and nose, but the lower face is both short and also slightly posterior in the chin region. Finally, we will conclude our treatment with small amounts of botulinum toxin. We will use botulinum toxin as a neuromodulator to try and elevate the tail of the brow. This patient presents with natural hooding of the upper eyelids, which frame the eyes in an aesthetically attractive fashion. However, the slight weight in the corner of the eye creates heaviness, as well as a more horizontal appearance to the brow. Again, to feminize the eye region and cheek region, we will create some elevation in this region, and concurrently also open the medial aspect of the eye by relaxing the corrugator and procerus muscle. A very small amount of botulinum toxin will be used in the forehead, as well as the chin to relax the mentalis muscle, which we can see on dimpling even on rest. We will start by marking out our area of treatment for the cheek. The zygoma is a palpable region along the lateral cheek, and the zygomatic process, as it fuses with the temporal bone, creates a nice arch for us to create support. We palpate the zygoma, and we can manually feel for the zygomaticotemporal suture line. This is a lateral point of elevation for us, which will create height and suspension of the cheek region. We will then palpate the malar eminence, the lateralmost portion of the cheek, and mark that as a second spot of bolus injection to create elevation. Finally, I will mark out the angle of the cheek and the area I wish to augment in order to create more height and definition for this patient. You can see that the marking is in a fairly vertical fashion. We are going to exclude adding hyaluronic acid to the anterior portion of the cheek where she already has good definition and volume to prevent too much augmentation in this region. We will then treat the area in the tear trough with a low hygroscopic filler, one that will not hold or retain too much water. I would like to add some support in the temple as well with hyaluronic acid in order to support and elevate the lateral corner of the brow, which we will further augment with botulinum toxin in this area. Finally, in the chin region, we are going to create more length and vertical height to the chin by treating the inferior portion of the central chin as well as the lateral portions of the chin. In the female chin, we want to ensure that we're not creating too much width and are trying to create a narrow and elongated face shape in this region. In this case, we are using the Mertz portfolio of Belotero fillers, and we're using Belotero volume, which has a high cohesivity and maximal lift capacity. Our point of injection for the lateral brow is 1 centimeter over and 1 centimeter up from the temporal fusion line and the orbital rim. This is a safer plane and location of injection compared to a more superficial layer, whereby the superficial temporal artery is coursing in the superficial temporal fascia. Our needle is right on periosteum, and a slow injection is performed. In this case, 0.2 cc's of filler are placed for suspension. The next attention is turned to the lateral cheek. Our previously marked point is elevated, and the needle is advanced straight down to periosteum. A small and slow bolus is applied here, generally between 0.1 and 0.2 cc's. Here we have used 0.2 cc's. Our next point is then injected in similar fashion right down onto the periosteum, and again a slow injection is performed in this location. Next, the area that was pre-marked as the anterior cheek region and lateral cheek region are treated with more hyaluronic acid, again, in this case Belotero volume. Care is taken not to add too much volume laterally to increase the zygomatic width. 0.5 cc's are used in this location to define the cheekbone and create an elevated look to the lateral portion of the face. When we observe this on front view, we see that the face actually appears slimmer despite the augmentation with hyaluronic acid. When injected in the correct vector in the correct location, a slimming profile can be created. Next, the infraorbital region will be treated, both the tear trough and also extending into the palpebromalar groove. An entrance site in the lateral cheek is chosen, which will allow us to augment both of the regions in the same entry point. A cannula is used in this scenario in order to minimize the potential for intravascular injection in the infraorbital region and also angular region, which are being treated currently. Only a very small amount of product are required in a young patient like this, and here we are using Belotero Balance, which has a lower likelihood of water retention as well as Tyndall effect. Our plane of injection is as deep as possible. The tear trough ligament and the orbicularis retaining ligament insert right into skin. Thus, the visible groove that they create must be treated with direct injection right through this layer. It is not possible to technically be on top of these ligaments, and we are actually injecting through them. It is important to avoid injection superior to these demarcations in order to avoid injection that is either in a post-septal area or in an area that is too close to the orbital rim, which will create persistent edema post-procedure for many months to come. On this side, only 0.15 cc's was necessary. Finally, in terms of volume augmentation, we're going to address the chin region. A cannula will be used to create both support, projection, and elongation of the chin. In this patient, approximately 1 cc of bilateral volume will likely be necessary to create the intended augmentation. The focus is to create length and elongation in a vertical dimension, as well as projection anterior posteriorly. We want to create a narrow chin defining point rather than an overly broad chin. A 25 gauge cannula is used to distribute the bilateral in an even fashion throughout the entire portion of the chin. Maximal augmentation is performed in the central chin area. Finally, some central product is placed right in the middle portion of the chin to create elongation. Following completion of this aesthetic treatment for a young patient with hyaluronic acid, we have completed the following tasks. We have increased projection and height of the lateral portion of the cheek to create a slimmer and higher look to the cheek. The slight tear trough and palpebromalar groove, the hollowing infraorbitally, has been resolved with small amount of volume augmentation. And the chin has been brought forward and anterior, as well as lengthened to create, again, a slimmer face shape to the face. Look at the view on side view, 3/4, opposite 3/4, and side view. Neuromodulator in this patient involves Xeomin for this case, and what we are doing is slightly opening the eyes by relaxing the corrugator and procerus muscle, as well as laterally in the orbicularis region. Have you start by frowning for me like that, concentrating, good, and relax. Total dose of 20 units will be used in this region. Our medial injection is deeper than our lateral injection as the corrugator muscle inserts more superficially and is anchored more deeply medially. Have you elevate your eyebrows high. To prevent over-elevation, the frontalis muscle is injected laterally. Following this, to improve the aesthetics around the lateral portion of the eye, can you close your eyes tight for me? We can see the contraction of the orbicularis muscle and relax, which will be reduced by Xeomin injection in the corner of the brow and the lateral portion of the orbicularis in 3 injection points. Similar fashion, the contralateral side is treated. And the mentalis is treated to reduce dimpling with a total of 4 units. So in this treatment for a 62-year-old woman, we are going to be using hyaluronic acid to do some facial reshaping as well as volumizing at the same time. She has wonderful skin quality, and for 62 years of age, she looks absolutely fantastic. Our goals will really be to do a full face treatment and work from top to bottom to create a more smooth, harmonious, and less aged appearance. In the central forehead region, we can see a concavity and flatness of the central portion of the frontal bone region, as well as enhancement of the supraorbital rim. To create a smoother contour through here, we will be revolumizing this with hyaluronic acid, extending mostly between the 2 pupils in the central portion of the forehead. As we work laterally, we will try and create a little bit of support in the temporal region. We can see that even at a fairly resting state, the patient tries to contract her frontalis muscle in order to lift the corner of the brow subconsciously. We will try and add a little bit of support in this region in order to prevent that, reduce the dynamic lines, as well as support the lateral eyebrow. For the lower orbital region, we'll be improving the infraorbital hollow by adding volumization first in the medial cheek and lateral cheek, and then by treating the residual hollowing in the infraorbital hollow directly with cannula. Laterally, we will be trying to add a little bit of elevation and suspension without creating too much horizontal width. Following that, we'll treat the pre-auricular or submalar regions on both sides to help support the jowl in a lateral position. Finally, we'll be working in the perioral complex by treating the nasolabial folds directly, which we will hope for improvement in with our lateral treatment, and then continue to treat the labiomental sulcus as well as chin to allow for more support of the lower portion of the face and thus create a smoother jawline. Whenever treating the forehead region, we must be cognizant of the arterial supply to the forehead. In particular, we are concerned about the supratrochlear and supraorbital arteries, which have direct communication, obviously, to the ophthalmic system, and thus are at risk for intra-arterial embolization and compromise of the central retinal artery. In order to provide a safe and comfortable treatment for the patient, I find that a cannula technique is most efficient in the forehead region. We mark out the important anatomical structures, including the supraorbital and supratrochlear arteries on both sides.